Hello, everybody. Reed here. Today, we're going to have a very interesting discussion about hypoxia. Yesterday, we reviewed vascular dementias, and remember, there are two types. Ones that when the vessel pops, hemorrhagic, right? The second type is when the plaques break off and the emboli they go downstream and they occlude the vessel. That's embolic. And remember, there's another type of sort of like vasoconstriction, constriction, um, obstruction when the microparticles break. When the microparticles, the very small granules break out, they don't clog the arteries. They clog like at this very small, at the microvessels, is at the microvesicular level. And you'll start to see the depth of the tissue distal to the obstruction, and it appears darker on the CT scan than the other live materials around it. Now, this injury results in inflammation, and that inflammation makes the blood-brain barrier porous. Because after the blood-brain barrier becomes porous, the person gets sort of like confused and diminished and sore and difficulty focusing. Just okay, all right. The cells and the cells themselves, the networks, are not functioning well if you don't have a secure boundaries or secure borders, right? And so porous blood-brain barriers leads to dysfunctioning networks, and it presents with difficulty thinking, difficulty awareness, and all the other things you can imagine. And so when that embolic and vascular process continues to move forward, you get this stair-step phenomenon, meaning something happened, something abruptly interrupted the system, and that interruption created cell death, and that cell death created inflammation, and now the whole process rinse, wash, and repeat, right? That cycle continues to go on, and every time it goes on again, the person may not recover their full level of functioning. That's very difficult for families to deal with. So you remember, you have to prepare them very carefully, let them know that the vascular dementias and things like that present with a stair-step phenomenon, right? Whereas things like Alzheimer's, particularly in the earlier stages, is a very gradual decline, right? So we reviewed those type of dementias yesterday. So in here, there's other, you can have dementias that's cognitive problems and things that's created by medical conditions too, right? In this one, we're talking about hypoxia, hypoxic brain injury. What happens when the entire brain doesn't get enough oxygen? Yeah, cerebral hypoxia. And it can result in the same issues. Can you imagine the damage globally? Insecure blood-brain vessels, blood-brain barriers everywhere. So you can imagine how hypoxic brain injuries may present with just a chronic low-lying level of sensorium and cognitive functioning, because the damage is sort of diffuse, and it's happening like everywhere, right? So we're going to look into the assessments and treatment of hypoxic brain injury. I'll try and I think it's going to go according to the same protocols we used the last time. Remember, an hypoxic brain injury can create damage almost everywhere, right? And understanding the parts of the brain and how they work can give us an idea of where the damages are likely located. And if we understood the networks and the blood supply and the receptors in those parts, then maybe we can look at those receptors. If we understood what's on those receptors, that if we understood the areas that were damaged, then we look at the pathways, we understand the receptors on the pathways, and now we try to select our tools. And now we have a target, right? And with these things, because it's based upon disruption, you get the balance straight and the people can see improvements right away. It's not like antidepressants take 2 weeks to work, but some of these things you can get improvement right away. So let's first let me do this. What am I trying to do? So we're going to look at anoxic brain injuries, okay? And I want to, Okay, let me clear this all out. Okay. Oh, first, let me look at some images of the brain. Let me see here. Just to show you the different parts of the brain, just to sort of review what they're responsible for. Brain. Let me see. Brainstem, cerebellum, the cerebrum. The whole yellow thing is the cerebrum, cerebella, brainstem. Okay. Remember this temporal lobe with Broca's aphasia, the language, and things like that, mood, temperament, rage, temporal lobe epilepsy. The rage, right? The temporal lobe directly connected to the amygdala. Disruptions in this pathway will cause disruptive behaviors, anger, combativeness, agitation. And then, it may be mixed with the Broca's aphasia, where they have difficulty with language. So here, that combination of combativeness, aggressiveness, anger, and then the language difficulties, right? And just you want to look for those things. So the person is just agitated, combative, and aggressive, and they have difficulty actually communicating, right? So you can say, hey, it seems like this may be that temporal lobe here. Okay, this frontal lobe here. This frontal lobe is the seat of your executive functioning, right? Attention, concentration, multi-planning, sequencing, organizing, divided attention, right? And so I guarantee you get damage in this area, you won't be able to function as an executive at all. You'll exist in a state called, we commonly refer to in the deep neuropsychiatric research literature as executive dysfunctional, meaning there's no executive planning at all. You damage that frontal lobe, there's no planning, there's no organizing, there's no multitasking, there's no sequencing, there's no impulse control. So it has all of those executive functioning difficulties, right? Remember attention deficit disorder? And we give attention deficit hyperactivity disorder. Why would you give a kid that's hyperactive a stimulant, right? Why would you give a kid that's hyperactive a stimulant? Why? Because it's targeting that part of the brain. It's going to stimulate that network. It's going to make the network in the brain more hyperactive. That's what coffee does, right? That's why I can't drink Starbucks coffee. Now, I don't want to say anything like that. I'm not a Starbucks coffee drinker because it's too strong. It activates that frontal lobe. And those people who drink that coffee, they are really focused, right? It's too much for me. I've learned to back down from that. So I just go with tea for now. So that's the frontal lobe is responsible for. You get an executive dysfunctional state. Now, the executive dysfunctional state is very dangerous, right? Because you have what's called bottom-up processing. I mean, your behavior comes from your gut and it explodes out your mouth, right? That's bottom-up behavior. That's when someone get impulses and they can't stop the impulses, and now they're acting upon the impulse. Whether or not it's violence, erotica, whether or not it's like things like learning or all these impulsive things. So whatever impulse, drug use and everything, if the person gets the urge and everything, they won't be able to stop. And then also there's an explosion. You know what I mean, right? You know what I mean. You try to stop that friend or that family member or that parent or something like that, or that child and everything from stop using any type of substances, right? They get antsy and everything. They start to pace and everything. You say, stop it, child, stop it. And then it escalates and then boom, right? That's bottom up process. You better be careful with that. You see that, run, right? It's a hallmark of unconsciousness. The person is simply responding to their biology without any consideration of the impact it's going to have on the outside world, right? And then also that frontal lobe is also responsible for inhibition, shutting things off, shutting things down. When you give a person with attention deficit hyperactivity disorder a stimulant, it activates those networks, and those networks are inhibitory in nature. So they shut everything down so that only one thread of information can get through. And that's how you're going to focus. Instead of everything getting through to your conscious and coming through at one time, you suppress absolutely everything except that one chord of what you want. And that's focus. That's attention and concentration. That's attention, but then if you can maintain over time, that's a concentration and focus. And that's the only way you're going to be able to understand your environment and master all the objects around it, right? So this frontal lobe is very important for that. Also, in the frontal lobe, you get damage to that. You get personality disturbances or personality dysfunction, because it's the frontal lobe that integrates all of this perceptual information so you can actually decide how to appropriately respond to someone. And remember, there has to be some degree of accuracy in your response. For example, if we're talking about a bike, right, your response should be about a bike. If I talk about a bike and you talk about something else, then it's going to be hard to sort of communicate with that person. These people may want to say bike, but when it comes out, they may say cow, right? Or they may perceive something different. That frustration really causes them, So they can have personality changes or personality disruptions and things like that due to the acute failure of their frontal lobe, right? Now, we also see frontal lobe impairments such as in alcohol. First drink, second drink, third drink, fourth drink, fifth drink, pop, right? Alcohol targets GABA. GABA results in inhibitory tone. When GABA turn down the networks in the frontal lobe, you release the inhibition. And now you get nothing but bottom-up processing. But this time, you fuel the bottom with some Everclear or some vodka. And that storm is going to pop out the top. You know what I'm talking about. Seeing these and what? The poor judgment, the personality disruptions, the mood issues and all that. Yeah. That's alcohol interfering and damaging that frontal lobe. And so we also have the parietal lobe here. Let me just update this real quick. The middle part of the parietal lobe, the middle part of the brain, the parietal lobe helps the person identify objects and understand spatial relationships where one's body is compared to the objects around it, right? The parietal lobe is also involved as interpreting pain and touching the body. The parietal lobe houses Wernicke's area, which is great for understanding broken language. Great. The occipital lobe and the temporal lobe. Okay, memory, speech, musical rhythm, some degree of reason. So I just wanted to briefly go through the different parts so that we can, and so your occipital lobe, the sight and things like that, cerebellum movement. So I at least wanted to go through those areas to sort of review them. See, because this is some of the things we're going to start looking at when we talk about the hypoxic brain injury. So let's see here. Let's see, explain. Okay, here. An hypoxic brain injury occurs when the brain is deprived of oxygen for a prolonged period, leading to damage or death of brain cells. Remember, the damage and death leads to the inflammatory response, and then the whole event starts from there. Oxygen is critical to brain function, right? In a way, you are dependent upon this environment for life with every breath. Think about that. I got to keep breathing in the environment in order to live, right? It's critical for brain function. And even a few minutes without it can cause severe consequences. The type of injury is often referred to as hypoxic ischemic injury when it involves reduced blood flow along with low oxygen. Yeah, that's the combination. Yeah, we discussed the ischemic part of it, and so here I'm talking about anoxic. Anoxic brain injury can result from various events that disrupt oxygen supply to the brain. Cardiac arrest, right? Stop heart pumping, halting, or oxygenated blood flow, right? Suffocation or choking. So when you see patients with these type of diffuse injuries where it's like it's damage absolutely everywhere, you see problems with things like psychoticism, and you see the mood related problems and everything. You see the impulse control related problems. You see the cognitive problems, and then like confusion, the deliriums, confusion, disorganization, and things like that. So you have a mix of all of those things. Suffocating and choking. So when you get that presentation, it's important that you identify at least what caused this anoxic brain injury, right? The cause is going to your treatment plan, your intervention, and everything is going to be different. It's a difference if someone was injured in anoxic brain injury versus someone was a victim and receive an anoxic brain injury. Those are like two different treatment plans, right? The victim, you're going to have to provide more services and more assessments and things as opposed to the person who fell into the pool or something like that. So these things, this anoxic brain injury, you have to be very careful in evaluating these patients and doing a very thorough social history to look for anything like abuse and things like that. Next is near drowning, right? Prolonged suffocation cuts off oxygen. Severe asthma attack, right? Carbon monoxide poisoning. Wow. Yeah, binds to hemoglobin, blocks oxygen transport. I keep forgetting that mechanism. Yeah, stroke, blood flow to the other parts of the brain. Trauma, severe head trauma, disrupt oxygen. Overdose, respiratory depression, reduces breathing and oxygen supply, particularly in opiates, heroin, right? Yeah. And let me know if you guys, hey, Pahar, how's it going? Mohammed, how's it going, buddy? Let me know if you have any questions. Also, here, mechanisms. Brain cells rely on oxygen to produce energy via aerobic metabolism. Without oxygen, cells switch to less efficient anaerobic metabolism, which lead to the buildup of lactic acids and other toxins. Wow. Within 4 to 6 minutes, brain cells start to die, starting with the most sensitive areas like the hippocampus and the cortex for thinking and movement, right? Prolonged oxygen deprivation leads to widespread cell death and permanent brain damage. You get so much damage. How are you going to repair all those blood-brain barriers? How are you going to make it semi-permeous again? And look, here it is also. Look at this page. Here's this hippocampus again. When we talk about the dementias, that the hippocampus is the central point of failure in all of these things, right? And it's the inflammation. The common point is inflammation, like say cocaine use. The cocaine causes inflammation in the hippocampus. The inflammation in the hippocampus result in the failure of encoding, meaning they cannot put any information on the networks in their brain. And so after cocaine use and things like that, they can have profound cognitive difficulties because they're not able to put any of the information that they're looking at into the networks on their brain so that those pieces of information could be considered when their ego goes to render their entire reality. It's a lack of information. When I test for patients with the memory problems, many of the patients with the hippocampal damage, particularly through cocaine and anorexia and anoxic brain injury, they may only be able to remember 20 to 30% of the information that's around them that they're presenting with. And it's very important for you to understand this situation because they don't know they have a cognitive and communication problems, and you don't know. So when you're talking to the person, you're thinking, you get 10 items, you're thinking they're integrating all the 10. And they think they're integrating all the 10, right? But they may only be integrating 2 out of 10. So your prefrontal cortex is going to use that working memory. The working memory in your prefrontal cortex, it should hold 10 pieces. If it can hold 2, you're going to render your reality based upon the information that's in it, right? And this is why this hippocampus is so important. And you get significant failure where you seem to have a deficit of information on these networks. It leads to more like an altered mental status, like a delirium, or it can lead to perceptual disturbances because you definitely disagree with the person in front of you. Why? You are the person with the memory deficit can only remember 2 things, and it's a world of 2 things, and they can see both of them. You think it's 10 things, and you have to think about this and compare that. And that was 2 things. Yeah, that's what's wrong with you. So no, this is the answer, and what's wrong with you, right? And then when you engage in with these people with these type of damage or these type of deficits and everything, there's a lack of insight into the inappropriateness of their answers or their perspectives, because only based upon 20% of the information, not 100% of the information. There's another characteristic that if they're 100% right, you can't tell them nothing. It's egocentric. Why? Because they see everything in that world. They see all the pieces right there in front of you. It's only 2 pieces here, even though they're talking about 10 pieces. So even though they're talking you back, in their brain, only 2 pieces registered, and when they render reality is based upon 2 items, not the 10. And there lies the permanent structural disagreement between you two. This is one reality, that's another, and the 2 shall not meet. I think you should just meet them. If you understand, if you are able to input 10 pieces of process, 10 pieces of information, and the person you're in front of can only process 2 of the 10, these are 2 different realities, right? And the higher functioning one has to leave this abstract world or this higher cognitive world and descend down into this concrete world where there's only 2 pieces. And in order to get along, you have to look at things from that perspective. And as long as it's not damaging to anyone or harmful to anyone, I think that you should just leave it there. And when you're in that person's world, you got to respect it because they know everything, right? And I suggest you not try, if it's not hurtful or harmful, I suggest you not try to tell them nothing. And the reason why, they won't listen. Why? None of the things you have to say is a part of their ego, right? All of it is, their ego is unaware of it. So it doesn't exist. Let me give you an example of what I'm talking about. Imagine I was in the Chicago Bulls basketball stadium, and I was sitting in where they do the jump for the balls in a chair. And let's say all the lights were out, and I'm the only one in the stadium, right? And it's darkness, right? And the darkness goes on forever, even though there's a boundary that I can't see, right? But I think that's my world, and that's all that exists. And all of a sudden, all the way up in the bleacher, I see the door open. I see the light, and someone comes in. And I say, hey, it's me down here. Talk to me. Hey, talk to me. That's someone entering your world. The stadium is the ego, right? Now, in this situation, the entire world is the inner surface of that stadium. And it's impossible for the person to understand anything outside of it if it's never been there and no one ever told it about it. But where did this person come from? The person came somewhere from outside your ego and now it appears in your world. So this person comes up to you and now you're having a conversation. You get it? Now, the problem here is the person who can remember all 10 items, their stadium has a glass ceiling, and they can look out the glass ceiling, they can see the sun. And because they can see the sun, they already understand that this is not the entire universe, that this is just my house. And there's stadiums, everybody in their own stadium, like everybody in their own stadium, right? But this is just my house. So the things that go on in here may not even go on out there. So at least you understand that when it comes down to conflict or uncertainty, at least you're not as definitive. At least you pause and say, hold on, I have to think about this some. And that's the benefit of being able to maintain all of those 10 things in your working memory or your prefrontal cortex, right? It gives you access to abstract reasoning. When you look up there at the top of that stadium and you can look through that sky and you can see that sun, you say, hey, I wonder this, I wonder that. There must be life outside of me, right? So I'm not the center of the world. And I should respect out there, because if I don't respect down there, I don't know what they have capabilities are, right? So there are all of these variations and exceptions that goes along with being able to store all these 10 items and to be able to access abstract reasoning when you put them all together. But this process doesn't take place with the person who's just locked inside the stadium. Locked inside the stadium is an analogy of what I would refer to as locked inside of the ego. That means that when that monitor comes on in a stadium and tells us there's a blizzard outside, we believe it. Oh, there's mayhem outside. Oh, we believe it. Oh, you need to do this. When that screen turns the light on, oh, you get up. When the screen turns the shower on, you take the shower. The stadium is controlling everything. And you're just looking around following it. So when the stadium says you're depressed, well, you feel depressed. When it says you're anxious, you feel anxious. Why? Why? Because you believe that's all that it is. So the patients who have this significant damage to the hippocampus and who are unable to get enough information in their minds to render an appropriate interpretation of the world typically know everything. I'm right. It's egocentric. It's about me, right? And then they are always willing to push the sort of force the issue in a more agitated, aggressive manner because their processing is bottom up. You make them frustrated, they won't be able to suppress the impulses. If they cannot suppress the impulses, then they need to modify the impulses or deflect the impulses or suppress them somehow so that your behavior doesn't come out like an inappropriate rage, right? That's what it's for. So the hippocampus here, prolonged oxygen deprivation leads to widespread cell death. Widespread, permanent, widespread, basically widespread brain cell death and permanent disruption of the brain cells, widespread, right? And damage is basically the computational problems that it has going on. Symptoms, they depend on the severity in the brain affected areas, right? Immediate loss of consciousness, confusion, seizures. Really, remember that confusion right there, the hippocampus, seizures, that temporal lobe, loss of consciousness, that could, anoxic brain injury. If it's very severe loss of consciousness, right? They may pass out or something like that. Okay, short-term memory loss. Okay, difficulty speaking, remember Broca's aphasia. Impaired motor movements, remember the basal ganglia. Coma, if it's too significant, right? Okay, long-term cognitive deficits, the impermeability in the blood-brain barrier, right? The diffuse brain cell death, right? The cognitive deficits as a result, the accumulation of the brain cell death, then that damages the networks. When you damage a network, it doesn't just turn off, meaning become hypoactive. It becomes dysregulated. Can you imagine that? If you damage the network, you think most likely to turn off, but not this. You damage the network, it starts bouncing around. It becomes unstable. And so you have the cognitive deficits associated with hyperactivity in all different parts. Cognitive deficits talking about psychomotor activity in the body. You can't sit down. Or it's like in your thought, you can't turn your thought off, or your speech keep talking too much. Yeah, so these are the cognitive deficits that result from those networks fluctuating back and forth. Personality change. Remember I said that frontal lobe, you damage that frontal lobe, of course, you're going to get executive functioning difficulties. You don't get inhibition of all of those impulses, right? You don't get to integrate all of the information that came from your prefrontal cortex because you only have two pieces of information. And what are you going to do with that? There's only two options, right? That means you're right every time. No matter the answer, you're still right. Movement disorders, the basal ganglia, and the persistent vegetative state, like if there's coma again. Yeah, so immediate loss of consciousness, then advance to a coma, and then now this persistent vegetative state. Let me see. Confusion, there's hippocampus, cognitive deficit, hippocampus. Let me see. Seizure, the brain tissue. Okay, moving on. Okay. Okay, treatment. Of course, restore oxygen, right? Medications, again, inflammation, right? Yeah, and then seizures, right? Yeah, it makes sense. So there's inflammation, the corticosteroids. Now, remember, you need the inflammatory response in order to take care of the situation of all this diffuse brain cell death. Reduce brain cell death. I'm getting a lot of phone calls now. Now, remember the seizures. I'm doing my podcast right now. Give me a minute. Okay. Okay. Let me see. Okay. And then, seizures. So we want to use things like Depakote. The anti-seizure medications are sort of, the Depakote will sort of raise the threshold for a action potential, and therefore it has the impact of slowing down the traffic on all of the networks. So Depakote is very useful for that. It's also very helpful for controlling the mood swings, the irritableness, agitation, combativeness, and aggressiveness. And also Depakote causes downregulation of glutamate receptors. Glutamate is excitatory. Glutamate, the overexpression or overactivity of glutamate may be causing the agitation, combativeness, aggressiveness that's seen in this process. So Depakote is one of those medications that result in downregulation of glutamate receptors. It also does one more important thing. It upregulates GABA receptors. So the GABA receptors are inhibitory. So when we lose some of those, we lose parts of those, the frontal lobe that results, if we get significant impairment in the frontal lobes that allows us to inhibit everything. If we get impairment of that, then I'm going to have to reach for Depakote and start raising the seizure threshold, slowing down all the traffic in the in the network, right? And then we want to start down with Depakote, down regulate GABA so it's not as excitatory, and start uploading GABA that's mainly inhibitory. So the quality of those fibers that are innervating the frontal lobe, we change how those we change the composition of those, and hopefully we can modify the pre-existing nerve cells to get them to play more of inhibition. We can also give a stimulant in this case if we want to try to activate this frontal lobe. So I hope that's sort of clear. Hope it's clear. Okay, therapies, okay, of course, rehab, physical, occupational, and speech, hypothermia, cooling the body to slow the brain damage progression. Prognosis, the outcome depends on the duration of oxygen deprivation and the extent of damage. It may mild causes may result in full or partial rehabilitation. Severe cases can lead to permanent disability, permanent in death. Recovery is often slow and plateaus 6 to 12 months, so some improvement may continue. Okay, I think that's all. I'm here at the 34-minute mark. Let me see if I can answer any questions real quick. Hey, Moeen, how's it going, buddy? How do doctors quickly assess the severity of hypoxic brain injury? The Glasgow Coma score. The Glasgow Coma scale is a number, and the higher the number on the Glasgow Coma score, the more severe the brain injury is. So, for example, patients who experience coma after anoxic brain injuries always have a high Glasgow Coma score because they were unconscious, right? Now, we need to see if they have retrograde anemia, meaning do they remember the events that led up to the accident? Or if let's see if that's impaired, or if anterior grade memory is impaired, meaning, do you remember where you were at and what happened when you woke up from this coma? So the severity of the Glasgow Coma score, the higher the score, the poorer the prognosis. Then you start looking for retrograde amnesia and then anterior grade amnesia. Here, hope that answers your question. Hey, Mohammed, how's it going, buddy? How can families support loved ones with hypoxic brain injury in the long run? Learn more about the process, because unfortunately, this is not intentional. The disruptions, the behavior, the personality things, none of that stuff is intentional. This is simply the best functioning that brain that was injured can obtain. And unfortunately, because it may result in severe damage to the hippocampus, the patient will likely exist in a concrete world, not able to encode enough information to gather enough pieces to figure out that the pieces are actually part of a larger structure. So I've always given an example of a man in a pit that's so deep that he can't climb out. And what he does, he looks around with him and he sees 10 pieces of wood. Right? Now, the man that can only remember 2 out of the 10 can only integrate 2 pieces at a time. But the man that can hold all 10 in his working memory, located in the prefrontal cortex, then they can look at all these 10 pieces and say, hey, these are pieces to a ladder. So all those concrete pieces, all together, abstractly, they form a ladder. And I can just put the pieces together and climb on out of here. But the man who can only remember 2 out of 10s, he says, okay, I have 2 pieces of wood. Even though he sees 10, he makes a plan for 2. He sees 10 pieces around him, but his brain can only hold 2. And so he says, wow, I have 2 pieces of wood, even though he sees 10. That's when you say, why did you do that? So that's when you say, I have no idea what would make you do that. You know what I'm talking about. Why would you? I don't understand, why would they do something like that? Well, their decisions are based upon a very small amount of information that they reacted on, whereas your perception is based upon a full information. You look at them and say, I don't understand how you even behave that way. And you do it all the time, right? Where am I at? Okay. So, yeah. So understanding these deficits, that concrete world and the abstract world, if you get this one thing, you save yourself from a lot of suffering, believe me. These worlds do not meet. You have to come down and join them in the concrete world. And as long as they're not hurting themselves, you got to let them be. They won't be able to engage in your world. They no longer have the processors to do those things. And they're only doing the best they can. And just because they can't access abstract reasoning and the things that you can do doesn't mean that they're impaired. Everything is working well. Yeah. It's just areas that's damaged, but the system is working well. If you didn't have the damage, right? So the persons are not defective just because they're bad people or things like that. No, their brain is doing the best they can do. And they probably would be very successful at an earlier period of time. Maybe like in the 1800s, or maybe go back in the 1600s. They'll be fine. All right. Let's see. Hey, iHash, how's it going, buddy? Hope you're doing well. Can hypoxic brain injury be reversed if caught early? That's the minor damage, but you don't want to get into that category at all. That's the with minor damage, yeah. With the mild to moderate damage, you're going to likely have some cognitive problems, or changes and things like that. And again, you always want to run from the information. You always want to run from that. Okay, well, it's been a pleasure. I hope this has been helpful for you guys on hypoxic brain injury. I think that's it for me. Read out. I'll talk to you later, guys. Ciao. Please like, subscribe, and share. Take care, guys. Ciao.